Welcome back. We now are continuing our discussion on H206 and have Mike Fisher with the Healthcare Advocates Office with us.
Good morning, Mike Fisher, Healthcare Advocate. It's a wonder today's technology that I can be driving on slippery back roads on my way here from Lincoln and listen to you and come in the door and be prepared.
Here we are.
We're supportive of the bill.
Right.
There were a few detailed questions that we had that we don't have complete answers to, but I don't think those questions should slow down. They're detailed questions. We don't think that they should slow down the movement of the bill. But I'll just mention them. One of them is sort of that definition of emergency dental. It's my understanding that that will go through a rulemaking process. The rulemaking process is a world that the HCA lives in. We respond to those. We get engagement often early and we respond. And so I feel confident that we get to do that engagement, and that and by the way, that's a good change. That Medicaid is clearly saying, hey, there are emergency circumstances where we want to be able to approve additional dental.
Can I just clarify, because we talked about putting in a definition of emergency dental services, and there's nothing in here that requires it to go through rulemaking.
Right.
So I don't know if that's a different proposal that be defined by rule.
I think, Ginger from Department of Health Access, I think typically what's specifically covered and not covered is in the United States statute. So I think my understanding from the policy team is that would be the preferred approach.
Okay, that's fine. I just think we need to put that in.
Okay.
Okay, so then you take out definition of it and said it will be decided by rule?
Right, exactly, as defined by rule.
And may I? Sure. It's not for him though. I'll wait.
Let's wait till.
And then the one other detail, just a few details about the dynamic when people have both Medicaid and a private insurance. For MCA Medicaid, for people under 65 and not disabled, the dynamic where we run into that, FYI, the dynamic where that happens is for kids. There may be edge cases now and then where it could theoretically happen for an adult, but I think it's kids where you have a higher income limit to be on Medicaid and where parents may have a private insurance. And so just wanted to make that point that that's where we see it. And then I did ask a question about exactly who it applies to in the private insurance world, and Medicaid is working on figuring out an answer to that, but I don't think that question should slow us down. I'm just wondering who we have the authority to tell what the bill tells.
Right. Okay.
So
We have to tell per the feds. Now we need to determine who we have to tell. Okay,
yeah,
great.
so supportive of the bill. Maybe while I'm sitting here, I'll just say the Vermont Prescription Monitoring System is something that I have a long history with. I sat in a committee down the hall when it was created, and we argued about it. And so I am appreciative of the continued effort to keep it narrowed. It's a healthcare tool and should continue to be used as a healthcare tool. So
Great. Wonderful. So we will hear from Leslie with your questions.
My question just for Jen, because we're going on break, I want to write my report. So how are you thinking? You'll like revise this and then send it to me?
So it's a process question, right? So she'll revise it and she'll post a new, and we'll have her come through and do a walkthrough of the changes, and then we will schedule a vote.
Okay, so the walkthrough might not be till we would get back. That would
Correct.
definitely not be till I would imagine.
Correct, yes.
So
Yeah, so we'll talk offline as to when Jen will have the draft written,
great.
be able to work with you. Okay, so we are back at 10:30. Please be a couple minutes early. We're having a joint hearing or joint testimony with House Committee on Education. we will be joined by Department of Mental Health and Agency of Education and representatives from all three of our congressional offices. We are asking DMH and AOE to talk to us and specifically our congressional delegation about the obstacles they have with obtaining federal funds for for mental health dollars in our schools. There was a bill that was signed into legislation, I think last year or the year before. It's called the Safer Community Act. And it specifically allocates quite a bit of money for schools and mental health. And we as a state are struggling to obtain access to that money because of the way we are locally controlled and that the way the bill is written. So it's really for us to listen. We obviously can ask questions, but I asked you to be here. And then just pay attention to your emails after the floor. If we can get back here to hear testimony on 282, we will. But things might get delayed. So just stay focused on your email or text me if you're having questions about what we're doing. So that will be the rest of our day. So please be back here a couple minutes before 10:30.